Welcome to the deep dive. Today, we're tackling a really challenging condition in horses. It's called Purpura Hemorrhagica, or, most people just say PH. Our goal here is to kind of cut through the heavy medical stuff and pull out what you really need to know, give you a clear picture of what's happening with PH.
And it's a fascinating one. It really shows you how complex the immune system can be. pH is pretty severe. It's immune-mediated, which basically means the horse's own defenses kind of misfire and cause this widespread inflammation in the tiny blood vessels. We call that vasculitis. And that leads to, well, pretty dramatic swelling and internal bleeding, too. Understanding it is really key for anyone working with horses.
Wow. Okay, sounds intense. So let's break it down. What exactly is Purpura Hemorrhagica at its core? You said acute.
Yeah, exactly. It comes on fast. It's acute. And fundamentally, it's this immune-mediated vasculitis. So inflammation attacking those small blood vessels. And that process causes these really distinct, often, frankly, alarming physical signs, things you can actually see.
Okay, immune-mediated. Can you simplify that a bit? Like, what's actually going on inside the horse that makes the legs swell up so badly?
Great question. So think of it like the horse's immune system gets triggered, usually by something like the bacteria that causes strangles, Streptococcus, equi. The horse makes antibodies, which is normal. But in pH, these antibodies form these little clumps, immune complexes, we call them, instead of just clearing the infection.
Sticky clumps.
Bad
clumps.
Exactly. Bad clumps. They circulate around, and then they get stuck in the walls of these tiny blood vessels. And once they're lodged there, they basically send out a signal, calling the cavalry white blood cells called neutrophils. Now, neutrophils are supposed to clean things up, but here they get over-aggressive. They release enzymes that, well, they actually damage the vessel walls themselves.
Ah, so the cleanup crew makes things worse.
Pretty much. And that damage is what causes everything we see. The fluid leaking out, causing swelling, the bleeding, clots forming, tissue not getting enough blood. The skin vessels are hit hardest, usually. And just because of gravity, hydrostatic pressure, the swelling and lesions are worst on the lower legs and under the belly. So main effects are on blood, lymph, immune system, heart, skin.
And is it common or just random horses?
It's sporadic, maybe 0.5% to 5% of horses after they've been exposed to strangles. More common during outbreaks, especially if a horse gets reinfected. But interestingly, no specific breed, sex, or age seems more likely to get it. It can happen to any horse.
That's, a bit scary that the body's own protection can backfire so badly. So what actually triggers this massive overreaction? You mentioned strangles.
Yeah, absolutely. Strangles, or rather prior exposure to Streptococcus equi, is by far the most common trigger.
Yeah.
And that exposure could be a full-blown case of strangles or even a really mild infection the owner maybe didn't even notice, or sometimes vaccination.
Vaccination? Wait, so the prevention could potentially cause it?
Well, yeah, particularly some of the older types of vaccines, the whole cell ones, or, and this is important, if a horse already has really high antibody levels from a previous infection or exposure.
So just to get this straight, a horse could have had mild strangles, seemed fine, and then bam, weeks later, this hits.
Exactly. It's that delay, usually 2 to 4 weeks. And the core issue is this over-the-top immune response, where the horse's antibodies, often the ones against a specific part of the bacteria called the M protein, they mistakenly attack the horse's own blood vessel lining cells. It's cross-reactivity.
Okay. Strangles is the main one.
Yeah.
Any other known triggers?
Yeah, well, strangles is number one. Our sources do list others, though they're rarer. Things like another related bacteria, S. equi subspecies, Zoo epidemicus, also Rhodococcus equi, which causes full pneumonia, and Corynebacterium pseudotuberculosis, that's the one that causes pigeon fever. Even some viruses have been implicated sometimes, equine influenza, EHV1, equine viral arteritis, and occasionally even a reaction to prolonged drug use. But sometimes, honestly, sometimes we just don't find a specific cause. We call that idiopathic vasculitis.
Right. And back to the vaccination thing, is it a definite risk or just a maybe?
That's a really good point, and it is a bit contentious. The evidence isn't totally conclusive that the vaccines directly cause it often, but some experts advise caution. They suggest, maybe not vaccinating a horse for strangles if it already has super high antibody levels specifically. They mention a titer over 1.32 thousand, especially if there's an active strangles outbreak happening.
Why then?
The thinking is you don't want to pour gasoline on the fire, right? Avoid pushing an already revved up immune system over the edge.
Okay, makes sense. So for someone listening, maybe a horse owner, what are the big signs? What should they be really watching for? Sounds like it can look pretty awful.
It can, absolutely. The signs vary, mild to, fatal. And like we said, usually pop up 2 to 4 weeks after the trigger. The absolute hallmark sign, the one you really can't miss, is severe edema. Just massive swelling, often starts around the nose and muzzle, kind of a swollen face look. Then it can spread to the whole head and really dramatically affects the lower legs and the underside of the belly, the ventral abdomen.
And how does that swelling feel or
Yeah.
change?
Well, initially it's usually hot and pretty sensitive to touch,
Okay.
but then over time it tends to become cold and not painful anymore. And it pits, like if you press your finger into it, the dent stays for a bit. It's usually not symmetrical, one side worse than the other maybe, and it doesn't usually seem itchy.
Okay.
In bad cases, you can actually get serum, like a clear yellowish fluid just oozing out of the skin. And the skin itself, especially on the lower legs, can die and slough off, leaving these nasty open sores.
Oh.
Yeah. And another really key sign is seeing little bruises, pinpoint ones called petechia, or bigger blotchy ones called ecchymosis, like bleeding under the skin.
Where would you see those?
Best places to look are on any light skin areas, but especially on the mucous membranes. Check the gums, inside the eyelids, the nostrils, the vulva-onomere, or around the rectum. And because of all that swelling and inflammation, these horses are usually really sore, stiff, don't want to move, they look lame.
So huge swelling, bruising, anything else common?
Yeah, definitely. You often see a fever. The horse will be depressed, lethargic, off its feed sometimes because the face swelling just makes it hard to eat. Heart rate and breathing rate might be up. Less commonly, but seriously. If the gut blood vessels are involved, they can show signs of colic. Nosebleeds can happen too, weight loss, and sometimes the muscles get involved, pain, inflammation, even muscle wasting over time.
Sounds like it can affect almost anything.
It really can. And then there are the really severe complications. Things like DIC, that's disseminated intravascular coagulation, where the clotting system goes haywire, or kidney damage, glomerulonephritis, which can sometimes lead to chronic kidney failure down the road. And there's a particularly nasty version called infarctive PH. That's where tissues, like in the gut or muscles, actually start to die because their blood supply gets cut off by the vasculitis. That one's often fatal pretty quickly within days.
Jeez.
Yeah. And on top of all that, you worry about secondary problems cropping up, like laminitis or blood clots forming in veins, or infections setting into the damaged skin. Sadly, death can happen from complications like severe pneumonia, heart rhythm problems, kidney failure, or just overwhelming gut issues. It's a tough one.
Definitely sounds like a true emergency. So if you suspect pH, how does a vet actually confirm it? Seems like other things could cause swelling or bruising.
You're right. It can mimic other things. So diagnosis is a bit of a detective job.
Yeah.
Often, honestly, a presumptive diagnosis is made just based on those really classic signs, the edema, the petechiae, especially if there's that history of strangles or maybe a recent vaccination. But yeah, you definitely need to rule out other kinds of vasculitis, blood clotting disorders, or other things that cause massive swelling or bleeding.
So what about tests, like blood tests? Is there one specific thing you look for?
Not really one single smoking gun test, no.
Yeah.
Blood work often shows signs of inflammation and infection, like high white blood cell counts, especially neutrophils, high levels of inflammatory proteins like fibrinogen, sometimes mild anemia. If muscles are involved, you'll likely see high muscle enzyme levels like CK and AST. If the kidneys are taking a hit, creatinine might be up, and you might find protein or blood in the urine. And in that really bad infarctive form, you expect really high muscle enzymes, plus signs that the clotting system is being used up low platelets, changes in clotting times.
Okay. And what about those antibody levels you mentioned earlier?
Right, you can measure the antibody titers to S-equi, high IgA or IgG levels, particularly against that M protein like above 1.6400, or that higher 1.32 thousand level we talked about for vaccine caution. Those are definitely suggestive. But it's important to know they aren't definitive proof on their own. It's just another piece of the puzzle.
So putting all those clues together, what's considered the best way to get a firm diagnosis, the gold standard?
The gold standard is generally considered to be a skin biopsy. A veterinarian takes a small, full-thickness sample of skin from an affected area, usually using a punch tool. Then that tissue goes to a pathologist who looks under the microscope for the specific hallmarks of pH, things like damage to the vessel walls with neutrophil infiltration, dead cells, fibrin deposits, what we call leukocytoclastic vasculitis. And because the lesions can be kind of patchy, it's actually best practice to take multiple biopsies and try to get them from very fresh early lesions, ideally less than 24 hours old, if possible.
Okay, got it. Biopsy for the win. Now, this sounds incredibly serious, obviously, but what's the treatment? And, what's the outlook? Can horses recover?
Yes, absolutely. There is hope. With prompt and really aggressive treatment, the prognosis is generally considered guarded, but often good. The sources we looked at suggest survival rates around, say, 70 to 90%. The main goals of treatment are, well, first, remove the trigger if you know it. Then, hit the inflammation hard, suppress that faulty immune response, and provide a ton of supportive care.
Right. And how do vets actually do that? What are the key treatments?
Corticosteroids are absolutely essential. They're the cornerstone. Usually start with high doses of a powerful one like dexamethasone, often given IV initially, to really knock down the immune system and inflammation quickly. Then, once things start to improve, they'll usually switch to an oral steroid like prednisolone for longer-term management. And this is critical. The dose has to be tapered very, very slowly, like reduce it by maybe 10–15% every couple of days, over weeks. Sometimes it takes, 4 to 6 weeks or even longer to wean them off completely.
Why so slow?
Because if you stop too soon or drop the dose too fast, the inflammation can just roar back. Relapse is a real risk. So slow and steady is key. Also, because steroids suppress the immune system, vets often give antibiotics like penicillin for maybe 1 to 3 weeks, sometimes longer. This helps deal with any lingering phalanx bacteria and reduces the risk of secondary bacterial infections taking hold while the horse is immunosuppressed. And then NSAIDs, non-steroidal anti-inflammatories like bute or banamine, are usually used too to help with pain, fever, and add another layer of anti-inflammatory action.
Okay, steroids, antibiotics, NSAIDs. But it sounds like there's more to it than just drugs. Supportive care, you said.
Oh, hugely important. Supportive care is vital and often really intensive. Things like stopping any non-essential drugs that could possibly be contributing. Using cold hosing hydrotherapy on the swollen legs helps a lot. Pressure wraps or support bandages can also help manage that edema in the limbs. Making sure the horse stays hydrated is key, so IV fluids might be needed if they're not drinking. If they can't eat because of facial swelling, sometimes a nasogastric tube is placed for feeding. Any areas where the skin has sloughed off need careful wound management to prevent infection. Gentle hand walking, just short periods, can sometimes help circulation in the swollen legs, but you don't want to overdo it.
Makes sense. A lot of nursing care involved.
Definitely. And in really severe cases, you might need more drastic measures like surgically draining any abscesses that form, or even, rarely, performing an emergency tracheotomy if the throat swelling gets so bad it obstructs breathing. Vets also have to be really vigilant about monitoring for side effects from the high-dose steroids, especially laminitis. That's a huge concern.
Right. Laminitis is always a worry with steroids.
Exactly. And because of that risk of kidney damage, we usually monitor kidney function with blood tests and check the urine for protein pretty regularly, maybe weekly during treatment.
Okay. So survival rates are decent with good care, but what things would make you more worried? What are the poor prognostic signs?
Yeah, while many pull through, you get more concerned if there's really extensive skin sloughing or signs that internal organs are significantly involved, like severe colic or kidney failure. Developing secondary infections, like pneumonia or infected skin wounds, is also a bad sign. And of course, if the horse develops laminitis secondary to the pH or the steroid treatment, that significantly worsens the prognosis. Recovery, when it happens, usually takes maybe 2 to 4 weeks for the main signs to resolve. But if there are complications, convalescence can drag on much longer. And one last thing, recurrence is possible. If the horse gets exposed to that same triggering antigen again down the line, it could potentially trigger another episode if it's not managed carefully.
Wow. Okay. So wrapping this up, what does this all mean for you, listening to this deep dive? We've really journeyed through a pretty complex immune reaction, haven't we? From the microscopic level, these immune complexes, right up to the dramatic whole body effects we see, and then navigating the diagnosis, the really intensive treatment. It truly highlights that paradox of the immune system, how something meant to protect can sometimes cause such harm.
It absolutely does. I think pH is a powerful reminder of just how incredibly sophisticated and sometimes how delicately balanced our immune systems and horses' immune systems really are. It shows how a normal protective response, like fighting off strangles, can just go wrong, become excessive and damaging. Yeah. And it really underscores why veterinary medicine keeps needing to advance to understand and manage these really intricate disease processes. The why becomes just as important as the what.
Yeah. It makes you think, doesn't it? Thinking about how an immune system can overreact so dramatically. Maybe. What other everyday instances do you see where a good intention or, a necessary response might lead to unintended challenging consequences, something to mull over?